I think we have more more people joining in, and I can already see Jana, I can already see Vaidya Janardhan Hebbar. Welcome, welcome. I can see Vaidya Vivek as well. I can see Amit. I can see Dr. Madhuri Devdhar as well. So great. I think we'll start in a couple of moments as well, and making sure that everybody gets time. I think we have a lot of registrations, a lot of excitement for our session today. I will tell you that. We've been getting a lot of messages and things. So there's a lot of excitement about our session today. So again, I want to thank all of you, all the panelists, all our viewers today. But we'll start officially in a couple of minutes.
Awesome. It's very exciting. Thank you, Gary. Thank you, everyone.
Great, Amit. I'm so glad you were able to join.
Yes, I'm right now in San Francisco.
Thank you. Thank you. This is a lot of encouragement for us.
Yes. Happy Holi to everyone. I guess Holi is tomorrow, right? Today.
Yeah, happy Holi to everybody who celebrate.
Yes. Yeah, they were going to have a big Holi party here in the Bay Area, but they canceled it. They moved it to next Saturday.
I hope everybody can see me as well as hear me properly at this point of time. Okay, great, great. So we are going to go ahead and start with our session. So I would like to welcome all of you to our Sambhasha series, which is Navigating Diabetes with an Integrative Approach by American Association of Ayurvedic Professionals, which is AAAP. The mission of AAP is to unite, educate, and empower all Ayurvedic professionals for authentic Ayurvedic practice, teaching, and research to improve community health and overall well-being. Our goal at AAP is to have more such educational events monthly as well. We would encourage all of you to visit our AAP website, which is aapusa.com, and become a member. We have various categories for membership. By becoming a member, you can help support AAP in its mission and also avail of various educational opportunities. Today, we would like to welcome all our esteemed panelists, our Vice President of AAP, Vaidya Meenakshi, as well as our President, Vaidya Amit Guman, healthcare professionals, Ayurveda practitioners, students, and Ayurveda enthusiasts to our session today on behalf of AAP. So let's start with a brief introduction of our panelists we have today. I would like to start with our introduction with Vaidya Janardhan Hebbar. Vaidya Janardhan Hebbar is a founder of Easy Ayurveda. He has completed BMS and MD Ayurveda in Ayurvedic pharmaceuticals. He also has a PG DPSM, which is postgraduate diploma in pharma sales management. He's an accomplished writer, author, public speaker Ayurveda with 12 ebooks, 350 video classes, 10 video courses, 2,700 plus articles, and much more. He has published various books such as Charak Samhita, volumes 1, 2, 3, and 4, Ashtanga Ridham, Sutrasthana, Madhav Nidan, Living Easy with Ayurveda, Tridosha Made Easy, Easy Ayurveda, Home Remedies, and much more. His mission is to elevate the lives of the world with the ambrosia of Ayurveda. He's currently the managing director of Easy Ayurveda Hospital and also Easy Ayurveda Private Limited. He served as a professor at Alva Ayurveda Medical College. He is associated with various Ayurveda organizations across the globe. Welcome, Vaidya Janardhan Hebbar. Our next esteemed panelist is Vaidya Vivek Agarwal. Vaidya Vivek Agarwal has completed his BMS and MD in Roga Nidan from National Institute of Ayurveda. He has a PhD in Rog Nidan from SR Rajasthan Ayurveda University, Jodhpur, Rajasthan. He has also served as a co-guide and PhD scholar of Ayush University, Kurukshetra, Haryana. He's published the book on exploring the pathological model on Prameha. He has been a resource person, served as a keynote speaker, and published more than 50 research papers. He's a subject expert and examiner at various universities in India. He's the director of BPS, Women University Alumni Association. He was awarded the Best Teacher Award in MSN Institute of Ayurveda. He's also in charge of the hospital's pathology lab, and also he's a member of various core committees at BPS Women University and MSN University of Ayurveda. So welcome, Vaidya Vivek Agarwal. Our next esteemed panelist is Dr. Madhuri Devdar. Dr. Madhuri Devdar is double board certified in internal medicine and endocrinology. She's a practicing adult endocrinologist since 2011 and currently is in practice at Endocrine Associates of Mid-Cities. She has been recognized in the top doctors of Fort Worth list for 4 continuous years. Dr. Devdar completed her residency at Washington Hospital Center, Georgetown University Hospital in Internal Medicine, and completed her fellowship from Georgetown University Hospital, Washington Hospital in Washington, D.C. in endocrinology, diabetes, and metabolism. She has authored a number of research papers and has extensive background in research studies on obesity, diabetes, and hypothyroidism. Welcome, Dr. Madhuri Devdar, to our session today. Our next esteemed panelist is Zarna Parekh. Zarna is an integrative and functional medicine dietitian and certified lead therapist with 25 years of experience. She's a firm believer of food as medicine and has helped thousands of people improve their health and practical nutrition and lifestyle interventions. Her specialties include gut health, autoimmune diseases, and metabolic health conditions. She is the owner and founder of Nutritionists by Z, a private practice in Dallas. She's very passionate about helping people find the root cause of their health problem and develop a comprehensive lifestyle plan to deliver long-term results to her clients. So welcome, Zarna Parekh, again to our session today. And lastly, it's me. I'm Gauri Janarkar. I'm one of the board members at AAAP. I'm a classically trained Vaidya, a registered dietitian, and a certified diabetes educator, and I will be moderating our session today. So a few house rules before we start our session. We request all our viewers to be on the mute throughout the discussion. Please put any questions you have in the chat feature. Another request we have is please do not discuss any personal medical information in the questions and the chat. Also, the information provided in the discussion today is just for general education purposes. The information discussed in the discussion does not provide any medical advice. Also, the discussion we have today does not substitute any medical advice. Please talk to your doctor or your healthcare professional before making any changes to your diet and lifestyle. So again, welcome everybody to our session today. So I see that we have a lot of people joining us. So again, welcome everybody who are joining in. And Vaidya Meenakshi is going to actually help us to look at, if there are more people joining in, she'll actually help us with that as well. So without further ado, again, we're going to start with some of the discussion questions. Again, a request to all of you is that if you haven't muted yourself, please make sure that you mute yourself. And any questions you have, you can please put it in the chat for us to have it towards the end of the session. So we will be discussing those questions towards the end of our session today. Okay. So let's start with our very first session. And again, this is a discussion panel. So we will be actually, how it's going to work is that we are going to actually ask this question to all of our esteemed panelists, and we're going to get a little more overview about what is their perspective as well. So let's start with our very first question we have is, what is diabetes? So this question, I definitely want to start by asking Vaidya Janardhan Hebbar first, is what does he think about diabetes when it comes to classical texts of Ayurveda? I would also like to have Dr. Vivek Agarwal as well join in and tell us a little more about what is the diabetes according to the classical texts of Ayurveda.
Thank you, ma'am. In Ayurveda science, diabetes has close relation to prameya, which is explained in all Ayurvedic literatures like Charak Samhita, Shushu Samhita. These are references for the prameya, which is closely related to the diabetes mellitus. Prameya means diabetes made up of two words, pra plus mehe. Pra means excess, mehe means urine, excessive amount of urine. That called 500 years ago in Samhitas, that's today known as diabetes. Another slogan, Prabhuta Avil Mutrata, means quantity. All acharyas explain the diabetes in 8 great diseases known as Astamahagad.
Okay, so looks like
connection issue. So yeah, go ahead, please.
Yes, ma'am. I'm audible.
Yes.
Charak also said that Prameho Anushangana. That means it's the best disease with all complications because Prameya involves whole body. This is a brief introduction of the diabetes which is related to the Prameya. Thank you, ma'am.
Dr. Vaidya Janardhan Hebbar, could you please also add what is your perception when it comes to what is diabetes according to some of our classical texts as well?
Namaste, and many thanks for having me in this elite group of health professionals. So the diabetes is one such disease which cannot be claimed by any one medical science that we have all the solutions. That's why I guess having varieties of people with various expertise in different fields makes much sense, adding much more value to what we are discussing here. So in Ayurveda Samhitas, it is explained that diabetes is explained as prameha, and like Vaidya Vivekji explained, it is explained as one among the Astamahagadas. Asta means 8, Mahagadas means major disorders. So all acharyas or ancient masters, they truly believe that if all the diseases in the world can be categorized as most important and less important, probably the diabetes would fall into the most important 8 disorders. So that's what they have explained. And of course, it is explained as a disease which encompasses almost all the body tissues, multiple systems, multiple organs, encompassing many things. Pathology is formed, and just like treating one particular organ or one particular metric might not give solution to this dreaded disease. So just for example, even the modern people also agree that just the sugar control in the blood and urine might not be sufficient for managing the complications. So it is a complicated disease as per Ayurveda, involving many systems, tissues, and body organs. And coming to the references of diabetes, it is explained as prameha. So first comes Sushruta, who is regarded as the father of surgery by the world itself. So he dedicates in total 4 chapters to explain diabetes. So first he explains Nidhanasthana in the sixth chapter, where he explains the causative factors and pathology of diabetes and so on and so forth. Then he explains Prameha as a group of urinary tract disorders, including diabetes, and its treatment in Chikitsasthana, that is the treatment section. And then he explains Prameha Pidaka and its treatment in a different chapter. And then he explains Madhumeha, which is more correlated with diabetes, in a different chapter. All are from Sushruta Samhita Chikitsasthana, that is treatment section, 11th, 12th, and 13th chapters. Coming to Charaka again, he explains it as one among the 8 major disorders of the world, dedicates 2 chapters to diabetes. One is Nidhanasthana, explaining causes and pathology and the components involved. And in Chikitsasthana, he explains about the actual disease treatment, panchkarma, etc., remedies, medicines, herbs, and so on and so forth. Even Ashtanga Hridaya, another major textbook of Ayurveda, dedicates 2 chapters, very similar to what Charaka Samhita has explained. And all in all, a disease, to conclude this open comment, a disease with multiple organs, multiple systems involved, even the mind, stress, sleep are also involved. A complicated disease with unique opportunities to counter it from multiple, with the help of multiple sciences, is diabetes.
Thank you so much, Vaidya Janardhan Thempar. Now coming to Dr. Madhuri Devdhar. Dr. Madhuri Devdhar, if you can tell us a little more about what do you think when it comes to what is diabetes according to modern medicine? Dr. Devdhar, you're on the mute.
Namaste to all, and thank you for having me on this in this extreme discussion. This is a very dear topic to me, fortunately or unfortunately, because we have seen a lot of mortality and morbidity from diabetes, and really want to do the best to help mankind with this disease. Thank you both the Vaidyas for explaining it so well from the Ayurvedic perspective. Now, as far as the English medicine perspective goes, it's not very different from what they're saying. Diabetes starts with having high blood sugars in the blood, and urine is nothing but filtered blood. So high blood sugars in the urine as well. And it causes inflammation from the all the less of the little blood vessels to the biggest of the big blood vessels, as well as nerves all over the body, and can affect multiple organ systems because of this pathophysiology. So high blood sugars, in English medicine, or the definition of diabetes is if your fasting blood sugar is greater than 126, it is called diabetes. Or if you have a random blood sugar of over 200, you can check it any time of the day. If your random blood sugar before meal, after meal, anytime, if it's over 200, or if your fasting blood sugar first thing in the morning when you wake up is over 126, it's called diabetes. We also measure diabetes by another factor called hemoglobin A1C, which is a very important measure because it gives us the average 3-month blood sugar range for that particular patient. And anybody with an A1C of over 6.5 is considered diabetic. Now, A1C of 5.7 and less than 5.7 is considered a normal patient, non-diabetic. And between 5.8 and 6.5, we classify them as pre-diabetic or borderline diabetes. And a lot of things can be done at this stage, in the pre-diabetes stage, before they hit diabetes, in order to push out the diagnosis and complications from diabetes by decades. And we are all going to talk more about that, looks like, in future questions. One thing I want to mention here is that, the multiple organ systems that diabetes can affect is vast and could be severe. And it leaves a person, kind of decapacitated if not controlled well.
Thank you so much, Dr. Devda. That definitely helps us with the modern medicine perspective as well. Now I'm going to turn to Zarna Parekh as well. Zarna, tell us about, when it comes to what is diabetes, went through the nutrition aspect, and you have experience when it comes to functional nutrition. Tell us a little more about that as well.
Thank you, Gauri, and thank you both the Vaidyas and Dr. Devdar. That's a wonderful explanation about the diabetes. And again, functional nutrition or a functional medicine. I'm not a doctor, so I'm going to focus from a nutrition aspect. And functional nutrition is very similar to both of the things that have been mentioned, as from the Ayurveda perspective as well as from a modern medicine perspective. The diabetes is not just one lab number that here's your sugars high. There's many things that are associated, including inflammation and multi-organ involvement, which a lot of people don't realize. And one aspect where I come in picture with a lot of people is definitely with the diabetes, but the pre-diabetes, like Dr. Devdar said, because that is the time to act and really help these people. And I don't even call them patients at that point, because they can really make a difference. They can turn with their health back. And that is where, from a functional nutrition perspective, we look at what are the antecedents, what are the genetic factors that are available, that are present, but genes are not destiny. And how do we implement changes in their lifestyle, which could be the triggers for somebody to lead towards a diagnosis. So we work on intervening from lifestyle factors in helping them prevent the further occurrence, or if they are already diabetic, how do they control with the lifestyle so that the needs of total medication load is lesser, and their overall health outcomes with inflammation and cardiovascular health is much improved that way.
Excellent explanation, Zarna. And I'm so glad that we are having this like a multifaceted discussion today, because we have people from different healthcare aspects as well. And that gives us a much more comprehensive view when it comes to diabetes as well. Let's talk about the next question is, let's talk about the pathophysiology. In Ayurveda, we call it Sambhasha. So, I definitely would like to start with Vaidya Janathan Hebbar to tell us a little more when it comes to diabetes, prameha. What is the Sambhasha? What is when it comes to the balance of the doshas? Tell us through the Ayurvedic perspective as well.
Thank you. From the Ayurveda perspective, it all starts with kapha dosha being high. Kapha dosha can be compared grossly with the nutritional component of the body, which soothes, nourishes, and takes care of all the body nourishment aspect. When it is normal, kapha dosha will support the body, but when it is abnormal due to excessive sedentary activities, excessive sweet intake, dairy product intake, all these are explained as the causative factors. So first, kapha dosha gets aggravated, and when it is aggravated, it further vitiates the fat tissue and the muscle tissue of the body, which are explained as medas and mamsa. So from there, the pathology starts, and it also affects all the liquid or fluid elements in the body. That is explained in Ayurveda. And all these factors, the kapha dosha, then the fat tissue, muscle tissue, and the liquid elements, which are called as kleda, they vitiate multiple organs. Mainly, it is explained as basti, which is related to urinary system. So they vitiate the organs associated with the urinary system. Then one dosha, when it is vitiated and it is not controlled or precautions are not taken, usually the other dosha also gets dragged. Then the pitta dosha joins, and pitta dosha is a fire element in the body, and it also causes a degeneration of the tissues. And then finally vata dosha joins, and it affects immunity, that is called as ojas, and it further deteriorates urinary tract. And this is explained grossly as a pathology of prameha. So what starts with extra nourishment, excessive nourishment, irregular food habits, and irregular sedentary lifestyle and irregular lifestyle habits conspires to vitiate the fat tissues, muscle tissue, the fluid systems of the body to cause this complex disease of diabetes.
Thank you so much, Vedyanathan Hebbar. Thank you so much. And I would like to again ask our esteemed panelist, Vedya Vivek Agarwal as well, to tell us more about, when it comes to pathogenesis, when it comes to Samprapti of Ayurveda. Please tell us through your perspective as well.
Thanks, ma'am. Dr. Janardhan already explained the Sahitas, Samprapti explanation. I will start with some pathological pathogenesis stages of the disease progression to the model. That means pathogenesis, it's pathogenesis for all disease, not only for diabetes. There are 6 stages who perform pathogenesis. Stages of accumulation, in which doshas are accumulate on the sites. Second one is stage of aggravation. Doshas are excited to move other areas, other part of the body as an aggravation. Next stage is stage of spreading the disease, spreading of the doshas. Like a glass of water in which we put water, then it spreads and then aggravate. In Ayurveda, known as Sanchay, Prakop, Prasar. After that, fourth stage of localization. That means where dosh, dush, shamushna occurs in the form of Ayurveda. That means prodromal symptoms of the disease appears at this stage. And doshas are accumulate at one place, whether they cause the disease. Next stage is stage of manifestations. Manifestations means at that stage, symptoms and sign and symptoms of the disease appears. That means, for example, we take of diabetes, symptoms like polyuria, polyphagia, polydipsia, and other symptoms. These are appears at this stage. And last 6 stage is stage of complications, where we can explain that disease is curable, not curable, what are the complications, what are the side effects, and etc. This is the basic concept of the pathogenesis of any disease, even diabetes. As Dr. Janardhan sir already explained the concept of the Samprapti, Medas, Manashamcha, Sarijamcha, Kledam, Vastukati, Dushya. All are doshas of vitiates and come to the Vasti. Vasti means bladder area, yani lower area of the abdominal. That's the main area of the, and in the form of the Shrotas, we can explain that it's Mutra Shrotas and Medvesrotas. Basically, diabetes disorder of Medvesrotas and Mutresrotas. Thank you, ma'am. It's okay.
Thank you so much, Vedya Vivek. This is really great, absolutely great. So then, when you talk about the pathogenesis of diabetes, I'm going to ask Dr. Madhuri Devdha to tell us a little more through the modern perspective, modern medicine perspective, pathogenesis and how does, diabetes develop?
Right. So the pathophysiology of diabetes is very complex. But, just to go about the most important factors, we divide the pathophysiology or pathogenesis or causes of any disease into genetics and environmental. And when it comes to genetics, there are some races, some populations that are more prone to diabetes than others. Uh, Indian race, as a matter of fact, is a little bit more prone to diabetes than the other races. But again, we can't change our genes. We have a lot of very good beneficial genes too. But what we can change is the environment. So when it comes to environment, it is, and I cannot help but say it 3 times, and all the panelists will agree, I'm sure will agree with this, diet, 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 and exercise, exercise, exercise. This is, diabetes has been known for centuries, as everyone mentioned here, but it has become more and more, more and more, more and more rampant in the new world, I should say, of late, just because of our lifestyle, lack of a good diabetes, diet and education, diet and exercise regimen. So extremely important, the pathophysiology of diabetes involves the causes of diabetes. Is diet and exercise or lack thereof of a good regimen. So I also want to mention here, I did mention that, in the causes of diabetes, we talked about, high risk populations, some races are more prone to it than the others, gestational diabetes. I just want to make a point here that, pregnant women can get diabetes due to various reasons. Again, the most important ones are the ones I just mentioned, genetics and environmental factors. And then these women are more prone to or more at higher risk of diabetes in the future as well when compared to the general population. Okay, and then I also want to mention, make a special mention for heart patients, heart patients, a very high risk population again. So heart patients, diabetes doubles or more than doubles the risk of heart problems, and patients with heart problems, and vice versa, patients with heart problems will have more problems from diabetes. So I just want to make a special mention to these high risk populations, but the causes are varied, but to put it very broadly, genetics and environment.
Excellent discussion, Dr. Devdha. And Zanna, I would like you to also add in your perspective when it comes to nutrition part, the functional nutrition part as well. When it comes to, development of diabetes, please pitch in.
Sure. So again, I agree with all the esteemed panelists. It's very well explained already. So I'll just add my 2 cents in there. It is a disease related to your diet and your lifestyle, what you put in your mouth. So we say you are what you eat, you digest and absorb. And unfortunately, our current diet in the modern world has become highly processed, loaded with sugars and processed ingredients, as well as the toxins that we are getting exposed to by use of a lot of pesticides and chemicals definitely create a higher toxic burden on the body. So that is definitely one of the contributing factors, along with insulin resistance, which really develops because of the food choices that we are making, constantly eating processed food, and then that brings the energy level down. So we feel again, we need to eat, and we eat again the same thing to bring that energy back up, but it keeps going, taking us through these fluctuations in the blood sugars, and that creates an environment that is absolutely conducive towards developing this way too much of insulin release in the body and creating resistance towards that. So what we focus on from nutrition side is how do we stabilize the blood sugar with right foods and lifestyle both together.
Thank you so much, Zanna. That definitely adds a little more perspective, to our discussion today. My next question is going to be, we have been talking about the pathophysiology, we've talked about what is diabetes so far. Let's also understand when it comes to, we know that there are different types of diabetes. So let's talk about what are the different types of diabetes, what are the types, what are the symptoms, and as well. Let's start with Vaidya Vivek Agarwal. Tell us a little more about when it comes to diabetes, what are different types and causes, symptoms according to Ayurveda.
Thank you, ma'am. Diabetes means Pramay. Pramay causes explained by the Charak in the chapter 6/4 with the shlok, because Ayurveda without shlok, not complete text. Hasya Sukham, Swapna Sukham, I will explain in Sanskrit then in English too. Because our literature in all is Sanskrit and explain in other languages. So we start endurance of the sitting in sofas, cushion for long period. That is Hasya Sukham. Swapna Sukham means excess sleep. Dadini Grami Odak Anuprasa Pyansi means taking curd, meat, soups of domestic animals, aquatic animals, marshy animals, and milk products. Freshly harvested foods, water, jaggery's preparations, and all other things which aggravate the cough. These are the basic causes of the diabetes pramay, which is correlated to the diabetes. And daytime, should also explain, daytime sleep is also prohibited, except summer season. It is also a cause of diabetes or pramay, lack of exercise, idleness. These explanation done by the Shushrup in Nidan Sthan 6/2. In the person with the above lifestyle, when immature arm, vat, pit, cough, integrated with the fat, move down to the urine and carrying channels. Channels means mutra sotas to opening urinary bladder and are restricted the different types of pramay originated. These are the basic causes. Pramay or diabetes is of two types, Sahaj, and Sahaj means Matra Pitra Bij Doshtat. That means morbidity of the Shukra and Shonit, and sperm and ovum of the father and mother come from the congenitally, or that means that known as hereditary diabetes, which comes from the प्राकृतिक शुक्र एवं शोणित संयोगम वर्ड यूज करा गया हमारे यहाँ. Second one is apathaj pramay due to the consumption of the erratic diet pattern and activities. And some prodromal symptoms which are in diabetic language, we can say that pre-diabetes stage. That is prodromal symptoms of the diabetes. Matting of the hairs, sweetness in oral cavity, numbness and burning sensation of the hand and feet, dryness of mouth, palate and throat. These are the prodromal symptoms of the diabetes. Pramay basically is the urine disorders, 20 types of urine disorders, in which we can say that Kaphat Pramay, Pittat Pramay, and Vatat Pramay. There are 10 types of Kaphat Pramay. I will tell you the name of the all pramays with the short description. These are explained by the Charak Nidanisthan 4/10-11. References are so important because you may check the literatures and cross-verify all the documents, all the words. First is Udak Mein. Udak Mein means these are the first 10 types of pramay. Udak Mein means excrete urine, white, painless and watery urine. Vision of the Charak is very clear. Urine is like sugar cane juice. At that time, there is no investigation done, no blood test, no blood sugar test, no HbA1c test. Only natural. They take natural cheeses and make the diagnosis. Sandra mein urine sample while kept overnight, it will be turbid and thick. That knows Sandra mein. Sandra Prasad mein urine is partially viscous, partly clear when kept overnight. Shukla mein pass in urine frequently in floor like floor urine is Shukla mein. Shukra mein is like semen. Sheath mein is sweet and cold urine. Sikta mein urine is painful and sandy. शने में excrete mucus and slimy urine slowly. Alal mein urine appears like full of threads and saliva, like appearance, that is alal mein. These are the 10 types of Kafach Prameh, which is explained by Charak. Next, 6 type Pitta Prameh, Chhar mein, Kal mein, Neel mein, Rakt mein. These are all the colors. Chhar mein means urine passes having small color alkaline like color. Kal mein blackish and hot large amount. Neel mein having Rakt mein urine having fleshy smell, saline, hot and red color. Marishtha में like decoction of the Marishtha, and Haridra में like Haridra, turmeric. And last one is 4 type of Prameh like Vasa, like fat, Majja, like ghee, Hasti, passes urine like quantity like the elephant, intoxicated urine, elephant. And last is Madhume, urine is taste and color of honey. All types of prameh is not treated. If all type of prameh are not treated, that lastly convert into the madhume, which is known as exclusively known as more related to the diabetes mellitus. That's about the causes and symptoms and types of the diabetes. Thank you, ma'am.
Thank you so much, Vaidya Vivek. It's a wonderful explanation. I would like to also ask Vaidya Janardhan Hebbar to add in to that as well.
Yeah, Vaidya Vivek has covered almost all the points. Like Dr. Devdarji was explaining, diabetes has become a problem of abundance these days. Previously, we were more physically active. We used to go to fields, and our grandparents and their grandparents were going to field, plowing and hunting and gathering and so on and so forth. But and previously there were certain sweets available only in certain festivals only, and season wise there was only certain grains were available in certain seasons, and it was having a particular dish. We were forced to wait for like 1 year for that particular festival to come so that we can enjoy that particular dish. So I'm afraid, we have had the Stone Age, Bronze Age, etc. Unfortunately, we are heading towards having a diabetes age, which we should all come together and avoid that. So these things are explained like Asya Sukham. Asya Sukha means Asya means mouth and Sukha means pleasure. So eating whatever you want to like, and Swapna Sukha, sleeping wherever you want to sleep. So these two are explained as main causative factors, and rest of the things Vivek ji has explained. And another important classification of diabetes, which is more important with respect to treatment, is as per Ayurveda. There is two major classification. One is Krisha Pramehi, and another one is Stula Pramehi. So diabetes associated with obesity is one categorization, and diabetes with body weight loss and person becoming lean and denourishment is another classification. Rest all factors were beautifully covered by Vivek.
Thank you so much, Vaidya Hebbar. And turning on to Dr. Devdhar, please explain about different types of diabetes, the signs and symptoms and the causes according to modern medicine.
So according to modern medicine, the diabetes is mainly divided into type 1 and type 2 diabetes. Type 1 diabetes is less common than type 2, but both the types are becoming more and more common these days. So type 1 diabetes is a kind of diabetes where there is insulin deficiency. Okay, and insulin is the main hormone that digests our sugars when we eat the sugars, when we eat the carbohydrates or sugars, and insulin digests the sugars. And if for any reason the insulin levels in the body are too low, the patient cannot digest the sugars the way they're supposed to. The body cannot intake the sugars, and the blood sugars stay high. And that's called type 1 diabetes. And the various reasons for insulin levels to go deficient are the two most important reasons are number one, destruction of the pancreas, which is the organ which produces insulin. And the most important cause of type 1 diabetes due to pancreatic insufficiency is what we call is because of autoimmune causes. Again, autoimmune causes due to various environmental factors, pollution, diet, all this in our modern world. Autoimmune diseases are becoming more and more these days, as opposed to 30, 40, even 50 years ago or 100 years ago. And type 1 diabetes, the most important cause of type 1 diabetes is autoimmune, where the body perceives the insulin producing cells in the pancreas to be an immune problem and starts attacking these cells and causes destruction of the insulin producing cells, which are called beta islets, and causes insulin deficiency. This is type 1 diabetes. Type 1 diabetes was traditionally in the modern medicine regarded as the juvenile diabetes, which means it was diabetes of younger people, kids, most likely kids were diagnosed with type 1 diabetes. But with a rise in the autoimmune diseases, we are seeing a lot of adults in their 20s, 30s, 40s, 50s, even 60s being diagnosed with type 1 diabetes these days. So type 1 diabetes is insulin deficiency. Now, moving on to type 2 diabetes, which is the most rampant, in type 2 diabetes, there is no insulin deficiency. The person is producing insulin, a lot of insulin, but the body is presenting with what we call insulin resistance in type 2 diabetes. What happens when there is insulin resistance? When there is extra fat in the body, fat is what produces insulin resistance. What happens is that there is a lot of insulin being produced in the body. The body says, but the sugars are not being, to put it in layman's terms, digested well by all this insulin because of the resistance being provided. So the body says, I'm producing all this insulin, the sugars are still not being digested. The body keeps increasing its insulin production. But if the person keeps eating, and their weight increases, lack of a good exercise regimen, the insulin resistance also keeps going up, where at some point, the body breaks down and says, I can't produce any more insulin. There is severe insulin resistance. It's like trying to push against a stronger and more resistant wall. So that's type 2 diabetes, which is usually associated with obesity. So type 2 diabetes, there is insulin, but there is insulin resistance. And there are a couple of other less common types of diabetes called latent onset autoimmune diabetes of adults, where we call it type 3 or type 1.5 for lack of a better word, where they can manifest as both type 2 and type 1 diabetics, where sometimes they look like they're insulin, and they have some insulin deficiency, but sometimes they look like they are okay, So treatment of type 1 diabetes is always insulin because their pancreas is being destroyed. They need insulin from outside. Type 2 diabetes, again, we'll talk about different treatments. But number one cause of type 2 diabetes, like I said, is insulin resistance from fat cells. So the first treatment is diet, exercise, and then we move on to different medications, including insulin if we need to. Now, there is also another fourth type of diabetes called maturity onset diabetes of the young, or MODY, which actually runs in families. If there is 6 siblings, all 6 of them could be diabetic at a much younger age. And this is mostly genetic based. Again, type 1 diabetes, there could be genetic factors. Type 2 diabetes, there could be genetic factors. And LADA and MODY are more genetic, but all of these are being affected by environmental factors. Now, coming to the symptoms of diabetes, in this day and age, a lot of people don't know that they're diabetic early on, because the most important or most common symptom of diabetes is being asymptomatic. They come to me, their sugars are running in the 300s. and they come and tell me 400s, 500s. They come and tell me, I never feel worse, I feel very good, do you have some increased urination? Maybe, maybe not. I'm not too concerned, 200, if the sugars are in 200s, they don't even have the increased urination. So the most common symptom of diabetes in this modern day and age is being asymptomatic. But then as the disease progresses, as the sugars go higher and higher for a more prolonged period of time, they can have polyuria, which is increased urination, polydipsia, which is increased thirst because of increased urination, and polyphagia, which is increased hunger because of them getting the blood sugars are high, but the body is still saying that I need more because of the pathophysiological state. So they get into a increased hunger mode as well. Initially, they may be overweight, but when they get into this, what we call this phase of a negative feedback, they actually start losing weight very rapidly, as their diabetes worsens. Again, when their diabetes, if it's still left untreated, undiagnosed, the sugars can hit 800,000. They can end up in the hospital with diabetic ketoacidosis, or what we call hyperglycemic non-ketotic coma, if it's left for months or years and not treated. Again, then the long-standing symptoms or complications of diabetes could be, heart attacks, strokes, diabetic retinopathy, which can ultimately lead to blindness if not diagnosed and treated, diabetic kidney disease, most common number one cause of patients being on dialysis these days, diabetic neuropathy. You have all heard of, probably seen some people, unfortunately, with their foot cut off because of diabetes, and ulcers and all this.
Thank you so much, Dr. Deva. This is wonderful. I mean, a lot of times, people are not aware, especially when you mentioned about the asymptomatic, right? That is definitely something that we all need to be aware of. So thank you so much for sharing that. Zarna, what would you like to pitch in, and what would you like to share?
I think Dr. Devdar has covered it all beautifully. So everything, as she said, yeah. Thank you.
Okay, wonderful, wonderful. So my next question, one of my favorite questions and very dear to my heart, we're going to talk about diet. So we're going to start with, when it comes to diet, we're going to start with ahara, and we're going to also talk about vihara. So ahara is the diet, vihara is the lifestyle. So I would like to start with Vaidya Janardhan Hebbar to tell us more about when it comes to ahara and the perspective when it comes to the Ayurvedic perspective of ahara, especially with diabetes.
Thank you. First, first method of treatment for any disease with Ayurveda is Nidana Parivarjana, means to avoid the causative factors. And in the list of causative factors, especially with the food, it's clearly explained. Milk and dairy products are explained as first causative factors for diabetes. So cutting down on dairy products is of a priority. And then excessive non-vegetarian intake, processed with different oils, the junk foods, everything is to be avoided. And there's a unique concept of in Ayurveda called as Navadhanya. The rice, wheat, barley, etc. They should be at least 1 year old before using it. If you are using it as soon as we harvest it, if you use it, then it is known to cause kapha dosha increase, which can cause diabetes. So that is also to be avoided, and grains should be at least 1 year old before they are used. And then sweet, jaggery, oily foods, junk foods, bakery items, everything has been explained as one of the causes of diabetes, so better to avoid them. So all these are explained, and then comes what is better, what are the good foods to take. One of the common indication for diabetes, common ingredient which is explained in the many textbooks of diabetes as a very good food ingredient to have is barley. So barley has lower glycemic index when compared to rice or wheat. And in terms of Ayurveda, there are certain food ingredients which are explained as patya. means which can be had on a daily basis from children to elderly age group. Everyone can have it. So barley is explained as one of the important dietary inclusions for diabetes. It is helpful to reduce weight if obesity is associated with diabetes, and also it is helpful to reduce the blood sugar as well. And then many other ingredients and varieties of barley and its derivatives are explained. And then another thing that is explained is called as sattu. Sattu is prepared out of yellow pea flour. And this, along with barley, is made into a flour, and that is used for preparing drink. In the northern India, it is very common, and the sattu flour and the barley flour combined together is advised to be used. And next important grain that is used is mudga or moong dal. Again, like how barley is explained as one of the must-have ingredients, this moong dal is also explained, and there are many research papers establishing the anti-diabetic activity of moong dal and its extracts in diabetic mice and so on and so forth. So these three are the main. And then tikta shaka are explained, a variety of bitter tasting fruits and vegetables. It can be bitter melon, it can be curry leaves, it can be turmeric. So all the bitter herbs are good to have during for diabetes. And good amount of fiber-rich diet, restriction on excessive fatty foods. And then in terms of oil, flaxseed oil, flaxseed and mustard are also explained as good to have for diabetic people in Ayurveda. So flaxseed is explained as atasi in Ayurveda. So that is told, and there are already many research published which says flaxseed supplementation improves the insulin resistance and helps in better glucose metabolism. So that and varieties of what we call as dry fruits, the chia seed, pumpkin seed, they are also very good. So walnut, almond are also can be included in the diet. So out of all the things, bitter herbs, avoiding freshly harvested grains, including more of moong dal and the barley in the diet, and flaxseed, these would constitute as a good dietary protocol for diabetes.
Thank you so much, Vaidya Dhananjay. I mean, that is really extensive. Absolutely. I would like to turn to Vaidya Vivek Agarwal. Please definitely tell us when it comes to ahara, especially in diabetes. I would definitely like you to focus more about when it comes to the spices, some of the Ayurvedic herbs and things as well. Tell us more about that through the Ayurvedic perspective when it comes to diabetes.
Thank you, Anne. In the terms of diabetes or pramay, we can take firstly flour. We are using daily in house. The flour is mixed flour. We can use mixed flour containing wheat, barley, black grams, and soybean. These four things include in the one meal, that is flour. Quantity are varying according to your choice. Wheat is in less amount and other things are in more amount. Secondly, there are two types of diabetic persons, obese diabetics and lean diabetes. In obese diabetes, there is importance of the purification of the channels, which leads to the removal of the arm and toxins. The food is just like which removes the arm and purifies the toxins of the body. In the lean and thin persons, we can use the santarpan, that means nourished, because it is already lean person, so that means that needs more nourishment to the body and required enhancement of the digestive fire, agnidipan. Secondly, we can explain the already you can tell about the do's and not do's and things. What are the fruits taken? What are the vegetables taken? in which I want to add something more, that is the concept of the glycemic index. Because we can take the food like in the view of glycemic index. We plan the diet according to GI index. GI index is role play the which provide the quality of carbohydrate and absorbs slowly. Low GI food absorbs in body slowly and enhance sugar slowly, gradually. High GI index is more than 70 and mid 56 69, and low GI products are 0 to 55. These improves the blood sugar level and increase the feeling of fullness, facilitate the weight loss, reduces the heart disease, prevent and manage the diabetes, and help to control the food intake. If we take the food which is low in GI index, then we can improve our diabetes through diet more frequently. Thank you, ma'am.
Thank you so much, Vidya Vivek. I mean, that was really wonderful that you talked a little more about the composition, especially of the flowers and things as well, and how you can mix it and, different herbs and things as well. So next, I'm going to turn in to Dr. Devdhar. Please tell us to the modern medicine perspective. What do you think?
So, very well explained. Diet plays a very, very important part. Like I said, we need to start. I'm sure all of you here will agree with me. Prevention is better than cure. So we don't have to become a diabetic to be on a good diet. Even when we need to make our lifestyle as such so that we never have increased risk of becoming a diabetic. Even when our A1C or our sugars are in the normal range, this has to start when we are younger so we can make this our lifestyle. So diet is an extremely important aspect of diabetes or pre-diabetes, or like I said, even before any unfortunate diagnosis of diabetes happens. Again, I'm not saying that diabetes diagnosis by itself is unfortunate. Diabetes diagnosis by itself is like a wake-up call. You can still do a lot of things to manage it. And I have had patients completely turn themselves around and go on no medications from having been very severe diabetics, especially in the early stages. So diet, like I said, I cannot help but say it 3 times. It's so significant. So basically, to explain it very, very simply, and I will let Zarna talk in more detail, low carb, low fat, high protein diet is the key. Rice, wheat, dairy products, all high carb, high fat, fried foods, potatoes, all the good things that we eat these days, pasta, pizza, potatoes, lots of rice, lots of rotis, all these are high carb, high glycemic index, which has been mentioned again and again, get your blood sugars to go high and cause problems. So what should we eat, Like Dr. Hebar mentioned, navadhanyas, there is different kind of other grains that we can incorporate in our lifestyle. Multigrain bread, multigrain flour is becoming more common these days, which is excellent because their glycemic index is lower, which is very good. Again, but I would really like to make a special mention here for green leafy vegetables. Green leafy vegetables, good organic, good fruits that are this seasonal fruits. You don't want to be eating mangoes in December. We don't know what goes in there to make mangoes in December. So good seasonal fruits, less sweeter fruits, lots of green leafy vegetables is the key. That should fill up your stomach. That should be a major portion of your plate. Very, very less roti or rice or whatever kind of bread you're eating on the plate should be there. So this how you change your lifestyle and your diet, and this has to be taught from, I think, from childhood, and just only because our lifestyle has not remained the same. Like Dr. Hebar said, we used to go out, walk more, exercise more, plow in the fields. It was part of the lifestyle. Now we get into the garage, we into the parking lot, take our car or two-wheeler and go somewhere and come back. It's not the same at all. It's not even close to what it was 20 years ago, 25 years ago when I was a child. or a teenager, you know. So I think lots of green leafy vegetables should be the key, the most important component of of anybody's plate. Diabetic, non-diabetic doesn't matter. And I will open it up to Zarna to talk more on that.
Thank you so much, Dr. Deva. That was really wonderful perspective. And definitely, I would like Zarna to, talk about, who's the next nutrition expert over here. Definitely talk about, the spices and things, Zarna, as well. And especially, there's when it comes to carbs and things, talk about that. And I would like you to talk a little more about, especially when it comes to the gut microbiome, because I know the GI is your specialty. So definitely talk about that.
Absolutely. Thank you so much, Gauri. Like you said, like this is dear to her heart. And what I'm loving this is whether we look at ancient medicine like Ayurveda, or we look at modern medicine or functional medicine, we all are screaming the same thing, that our lifestyle is where we need to make changes. So many commonalities between what the Habbar said, Dr. Agarwal said, Dr. Devdar said, that our diet is the key. So I'll start with one thing. It's about what I would push for is balance. When we let the balance go in any place, that's when the problem starts. Same thing with the diet. I think the modern diet has become so imbalanced. There is no proportional between the carbs and the protein and the fat and the fiber. And that is one of the things that I emphasize a lot. Of course, unprocessed food. That's the first rule. So all the Navdanyas, I actually learned something about the Navdanyas, like, the age-old traditions of that they should be at least 1 year old. I actually wrote that down because that's so, I mean, we did it all across growing up, but knowing that actually contributes towards more towards diabetes is very helpful. So definitely balance your carbs. Now, as a dietitian, what I come across, people are afraid of all carbs. And what I like to teach them is that not all carbs are same. So learn what are your good carbs and what are your bad carbs, or not bad carbs, but not so good carbs. So maida products or white flour, that is something that we definitely discourage them from using. Balancing the carbs with the protein. So again, just like it was mentioned earlier, that mixing the grains to make the rotis, and that's one of the things that I also preach a lot, that because that helps in lowering the glycemic impact on the body. So that is one thing that's very helpful. I teach them that there's, of course, the two types of the fiber. So soluble fiber, which helps in removing the toxins, binding the unnecessary lipid and glucose molecules out of the system, as well as the soluble fiber basically works like a broom, like just cleans out your system. So about half a plate as your should be more from a high fiber foods in general. So that's one of the key factors. Healthy nuts and seeds, not being afraid of those kind of fat, versus, of course, the fried food is something that we discourage. And then taking it to the next level of the phytonutrients or the herbs or things like that. So definitely encourage a lot of use of cinnamon in their food when they are cooking. So if they are cooking a bowl of oatmeal, which is great. And just like the Janardhan said, that, the barley. So, barley and oats being very high in beta glucans, they are very beneficial for blood sugars. And when you combine that oatmeal with cinnamon, you are adding a little garnish on top of that, but that actually helps your blood sugar even better. The next one is, of course, the fenugreek, which we use a lot in Ayurveda and in Indian culture as well. But fenugreek definitely helps with the blood sugar control. And then bitter foods. So all the bitter melons and the leafy vegetables, the methi and the kale and all the cruciferous, which helps in also supporting your liver detoxification cycle. So it's all about the whole cycle. So those are some of the things. I would also like to mention soy isoflavones, which are very, very beneficial as well. So a good quality soy brings so many things, protein, low fat, but also very rich in isoflavones. So finding those functional foods, that these are like top 6 foods you should eat. And that really starts to help with making some of those changes. So that's the diet side of thing. And then again, as it's mentioned by all the panelists, that the lifestyle. So looking at your activity level, your stress factors, because as we all know, and I think Gauri, you are probably going to get into the stress part, so I won't start too much on that, but really balancing, again, starting with balance and ending with the balance, that balance in every aspect of our life.
Excellent explanation, Dharna. Thank you so much for especially talking, when it comes to the gut perspective as well. So my next question actually is going to be with respect to our lifestyle. And, when it comes to lifestyle, stress as well, the stress management, sleep as well, what effect does it have when it comes to diabetes? We know that, when it comes to the gut effect, right? What affects the body affects the mind, and what affects the mind affects the body, especially. And just for everybody who's here, I mean, think about the gut theory. Gut theory is not something that has been discovered in the modern times. Ayurveda has been talking about the gut theory for thousands of years as well. So again, I'm going to talk definitely ask about when it comes to lifestyle, when it comes to stress, when it comes to sleep, what effect it has on diabetes. I would like to also have the panelists discuss some strategies as well as when it comes to stress management, give us some tips when it comes to lifestyle as well. Let's start with our with Vaidya Vivek Agarwal. Please tell us about that.
I will start through the stress theory of the diabetes. It is the universal human experience. Is stress defined as non-specific response of the body to any demand. We are all in stress. Stress are two types: eustress and distress. Eustress means we are stressing about, we are on top, we had got promoted in office. So these type of stress are eustress. These are good stress. But imbalance between the needs and resources, this is a distress. So there is difference between the two type of stress, eustress and distress. Prolonged stress creates a vicious cycle that results in the metabolic dysfunction. If we take prolonged stress, then converts into the leading to the type 2 diabetes. You can say that high or chronic stress leads to the stress to the hyperglycemia and development of the insulin resistance. That's why chronic stress leads to insulin resistance. Acute hyperglycemia during time of stress can be beneficial for the body and part of the evolution of the body. For the management of stress, yoga is the best, most beneficial coping strategies through the release of the non-chemical in the brain. The yoga therapy, already various studies are done for the stress relieving asanas, Surya Namaskar asana. The Surya Namaskar is the excellent way to remove the stress because there are the 12 asanas in one Surya Namaskar. Second one is change lifestyle, lack of sleep can also increase the stress. To prevent the stress, there are two approaches. One is to avoid the factors inducing stress and vitiating doshas. Secondly, to increase the coping capacity of the body. That means Ayurveda provides rasayan therapy to reduce the stress, achieving the healthy peoples. There are a lot of rasayans in Ayurveda, Amliki rasayan. These are the antioxidants which enhance the balance, which balancing the agni and digestive and metabolic process. So these rasayans role play antioxidant, antidepressant, immunomodulators, and etc. So these are the properties which can reduce the stress of the body. And in the gut biota microbiome, there are ginger, triphala. These are the good product to microbiotas. This prevent the disease and disease causes of the disease, which are the good gut flora, which can absorb the things, foods, etc. And for the management, we can say that some leaves like Sadabar plant, this can also reduce the stress, diabetes status. Harsingar, Pushpa, flowers, these also reduce the these leaves and flowers also reduce the stress and increase the our gut biota. Okay, thank you, ma'am.
Thank you so much, Vaidya Vivek Agarwal. Dr. Vaidya Janardhan Hepper, would you like to talk about the lifestyle, stress, and sleep, especially when it comes to diabetes with the Ayurvedic perspective? And give us some strategies as well.
Yeah. Stress has been explained as a cause for diabetes. Like there is Vata type, Pitta type, and Kapha type of diabetes. In all these three types, causative factors are explained separately. And everywhere stress is mentioned directly or indirectly. For example, in a Vata type of diabetes, causative factors, if we enlist all those things, psychological trauma, avoiding meals, anxiety, grievance, insomnia, and distractive mannerisms. So these are explained as causes for Vata type of prameha. In the Pittaja prameha, again, excessive anger, uncontrolled emotions are explained. And in the Kaphaja prameha, again, sedentary lifestyle, excessive depression, avoidance of daily routine due to depression, wrongful behavior, all those things are explained. So how the stress affects on the body, to explain that, I think there are better panel members than me to explain that. But how to manage that? In Ayurveda, there are three ways it is explained. Daiva Vyapashraya, Yukti Vyapashraya, and Sattva Avajaya. Daiva Vyapashraya is where, it is like, for those who believe in God, divine therapy. At least what I suggest to my clients is, whatever may be your daily routine, at least 10 minutes of your day should be given to, if you believe in God, then chanting Om, pranayam, singing a bhajan, maybe with all the members of the family together and chanting some shlokas. Or if you are blessed to have a mantra as given by your gurus, chant the mantra. So do something in solitude and do something together with the family, so that at least you are running from AM to PM, you are running all around doing many things, ethical, unethical, legal, illegal, whatever. But at least you have to find 10 minutes to center yourself and find your inner center, so that you can feel fresh and process what has happened throughout the day. So that is there. And in Ayurveda, apart from that, mantra, bali, homa, etc. have been explained. And another thing that I tell, which is not say, it's a little bit of unconventional. It's unconventional, but mentioned by Charak Samhita. It's explained that Satyavadinam akrodham nivrutam madhyamaithunam ahimsa kamanayasam prashantam priyavadinam. So these are explained as stress relieving measures. Satyavadi, be truthful. Akrodha, always be truthful, at least close to the truth as much as possible. Akrodha, avoid anger, avoid excessive alcohol and excessive sexual activities, seek peace rather than violence. So these are they look old and they have been mentioned in the ancient textbooks, but relevant to today and tomorrow and maybe forever. And coming to the sleep also, we are living in the information age and everybody has this one. Major challenge with respect to behavioral therapy is to ask our clients to avoid smartphone for the last 1 hour of the day before they go to sleep. So that is a challenge, but that I keep on brainwashing them and avoid, especially because the diabetes affects the elderly people more. Avoid talking about conflicting or controversial things in the night before bedtime. It could be politics, it could be national level politics, or it could be your inner family politics. Just avoid office politics. Avoid at least at that time. You can do it maybe in the morning. or avoid it altogether. And there are, of course, Ayurveda medicines to relieve stress and diabetes both together. Guduchi is one which is rejuvenative, useful in diabetes, and also explained as a Medhya Rasayana, so very good in that. Brahmi, Ashwagandha, Amlaki, Shankapushpi, and these are good for relieving stress and also to address the diabetes, blood sugar level control, rejuvenation, etc. And when it comes to sleep, there are many herbs, but Jatamansi and Sarpagandha stand tall in managing that. So as much as possible, we try to maintain with the diet, lifestyle, counseling, etc. And herbs are chosen only when they are required.
Thank you so much, Vedana Hebbar. Dr. Madhavi Vedhar, tell us a little about when it comes to lifestyle and sleep and the effect when it comes to diabetes.
Right. So, like I've been mentioning again and again that lifestyle is most important. Acute stress, you hear somebody is sick in the family or death in the family, or even day to day, some little stress, I got to get to work. All this, uh, you know, does suddenly if there is some acute stress that according to English medicine does not raise your blood sugars. I wear something called a continuous glucose monitors, and I check my sugars with the continuous glucose monitor. It checks my sugars 24/7, and I do go through acute stress moments, during the day. My kids are not in school at the right time. I'm running 5 minutes behind at work, I'm stuck behind an accident, stuff like that. Suddenly it does not raise the blood sugars. But the issue here is not just acute stress. It's the chronic manifestation of stress. I think that from the English medicine standpoint, the way that this can lead to diabetes is because this chronic stress, we start focusing on all these other factors of life, completely quit meal prep, what are the right things to put in the body, and exercise. Diet and exercise extremely important. When the chronic day to day, we are just involved from morning till night in all other things. We have to center and ground ourselves, like Dr. Hebbar said, and then think about what we are putting in the body. How can we make it better? How can we prep our meal better? So there's a lot of green leafy vegetables, less carbs, and even the carbs that we are eating are the good ones, good protein, good amount of protein. How we can balance this? It needs some free mind and stress-free situation and time dedicated to this. In order to do this, it's very easy to go and order Uber Eats or that or this and pick it up and bring it home and eat whatever. But that's not the point. We need to ground ourselves and give the food in our day the respect and the time that it deserves. And that's exactly where the chronic stress steps in. The other thing with chronic stress, I see that, day to day, we are all running, we are doing that, this, that, good stress, bad stress, all kinds of things. Ultimately, the first thing that drops out is activity, exercise. The American Diabetes Association recommends 30 minutes of brisk exercise every single day. Brisk is which brings your heartbeat up. What is brisk for me may be completely different from what is brisk for an 18-year-old boy, may be completely different from what is brisk for a 70-year-old woman. Whatever is brisk for them, whatever they can tolerate. They should not push themselves, but whatever is tolerable and the right thing for them, extremely important. Now, the Indian Diabetes Association recommends up to 60 minutes of a good exercise every single day. It could just be walking. It could be yoga at a good pace. It could be doing Surya Namaskars, its whole body is exercising. It could be stretches. You could be playing basketball, swimming, but it has to be every single day. The most important aspect of managing lifestyle with respect to diabetes is, diet prep, good diet and exercise. And the key word I want to mention here is every single day. It's not, oh, Saturday, Sunday, I will do my best. Monday to Friday, I'm busy. It doesn't work that way. It has to be every single day, and they need to be given their due respect and time in your lives. The only one other thing I want to mention here is, This has been mentioned, food has become very easily available. All kinds of food are available all throughout the year. You can, it's at the hands of your phone. The portion control is something that needs to be given a special mention here, not just filling up your plate again and again. Oh, I'm stressed, I'm eating more. Oh, I can't, I don't even know how much I'm eating because I'm stressed. We can't do that. We need to give it some time and thought process into it, because all this will affect our sleep, how we feel throughout the day, how many carbs we eat. We all know that once we eat a high carb diet, we are feeling sleepy. You go to a wedding, eat a good diet, come back, you're very sleepy. You can't do anything in the afternoon, right? So we all know that, high carb diet affects how our mind, there's a direct relation between our gastric system and our brain. And, that's why we really have to give the time to think about what we are putting in the body, so our body and mind can be as active as possible. And that will promote good sleep in the night.
So much, Dr. Devdhar. Zarna, what would you like to add into that?
So yes, I mean, it's very well covered by all the three panelists. So one thing I would like to add, and I think, Gauri, you asked me, and the last question, which I totally missed, that the gut connection and the thing. So I would like to focus on how that stress can affect your gut microbiome. And so it affects in sugar levels in many different ways. Of course, there's hormonal changes that happens with stress, cortisol increases and things like that can also contribute, but also the gut microbiome changes when we are under stress. So the way I explain to people is like, you don't like to be in a place where there's bickering going on and there's things that are going on. So if you are in a stressed environment, even the good bacteria don't like to live there. So they basically what ends up happening is that your diversity of your gut bacteria starts to reduce when you are under constant stress, which definitely contributes your more tendency toward getting diabetes. There's a very specific bacteria that has been really highly correlated with the diabetes, Akkermansia muciniphila. And there's a straight connection between overall lifestyle and our stress factors that affects the amount of Akkermansia in our body. Also, the butyrate producing bacteria does reduce when we are under situations of stress or in a situation of poor diet. So gut microbiome, as we say in every medicine, I think so, whether it's Ayurveda, conventional, traditional, modern medicine, or functional medicine, that gut is the center of our health and everything starts and ends in the gut. So if the microbiome is disturbed, that can absolutely create a lot of problems. Stress is there's the way we listen to, the way we react to is what is stressful for our body. So it's very easy to get stressed, and for all of us, I'm sure that just because I'm talking on it doesn't mean I don't get there. But one thing we need to start is that, again, on a more of a pillar before we get into that stress situation is that start your day with at least one thing that you are grateful for, or end your day with one thing that you are grateful for. By doing that, it's not going to wash away all the other stresses that come in, but it's at least going to reduce the impact of whatever that stress is bringing onto you. So we focus on what we don't have all the time, and by really focusing on that gratitude aspect of it, we can really start noticing that, oh, there is something good about it. Now, if we look through gut and brain connection, and we also talk that, neurons that fire together, they wire together. And when we keep saying little positive things on a consistent basis, we are also helping our outlook to look a little bit different, which can be very, very helpful. So I didn't want, we all know stress effects. I just wanted to give you one of the tips that I try to incorporate myself and with others that I work with, that what can you do? I cannot take your stress away. Nobody can. It's you who have to start looking at it in a different way.
Thank you so much, Zarna. That is wonderful. I mean, especially when you talked about the gut microbiome, which is such a big thing right now. With the gut theory, we know that the brain and gut axis and the effect as well. So thank you so much for adding that as well. So I think looking at the time, we are we are short of time right now. So we have focused in this discussion about when it comes to, our pathogenesis, we talked about, what is diabetes, we talked about the different types, the different signs and symptoms. We actually added also on the diet part, the lifestyle part, and that's all, frankly, we have today. So we have some questions that our viewers have asked. So I'm going to go through a couple of questions. We don't have time for answering every single of them, but I'm going to take a couple of questions that I'm going to ask. So let me have a look at this. Okay. So the first question is for Dr. Devdar. How about epigenetics and when it comes to diabetes, what would you say about that?
You are on mute, Dr. Devdar.
Okay, I am also reading this question on the chat. So I'm just going to reread the question, Gauri, if you don't mind. Epigenetics is correlated with environmental factors. For example, if you change your lifestyle, you can at times beat the genetic predisposition, is the question. Very, very good question. We can't change our genes, like I mentioned, but can we change our lifestyle to make things better for us? Absolutely. That is the whole goal. What can we change? What can we make better in order to prevent or treat this disease condition, or at least prevent the complications if we have already been diagnosed with diabetes? That is the main thing. That's why we stress so much on diet and exercise, and sometimes use of medications, when things are not going in the right way, in order to prevent the long-term complications, mortality and morbidities associated with diabetes. Yes, I absolutely agree with that.
Thank you so much, Dr. Devdar. The second question is for Vaidya Janardhan Hebbar. Instead of talking about convention, medicine, food and categories, what would be recommended based on Ayurveda, the different rasas?
So yeah, I mean, Ayurveda explains about 6 different rasas, so the tastes. Sweet is the major culprit, as explained, and the other 3, the Katu, Tikta, and Kashaya rasas, mainly the bitter taste. Bitter tasting vegetables are praised. Most of the anti-diabetic Ayurvedic medicines and herbs are bitter in taste, and astringency also, like we have the Triphala where Kashaya rasa is dominant. So those are given due importance. And also spices are very less talked about. Spices are also important in the treatment of diabetes, in that, for example, Trikatu is told as the best remedy for meda or obesity. Whenever there is fat metabolism problems or disorders, Trikatu or the ginger, black pepper, and long pepper is explained as a major remedy. So varieties of spices, especially cinnamon, cardamom, and then the fenugreek, fennel seeds, ginger, cumin, they have potent anti-inflammatory effect, and they also correct our metabolism, also helps in fighting the obesity as well. So these are the few topics we can talk in relation to taste and diabetes.
So much, Vaidya Janardhan Hebbar. The next question is about asking, according to modern medicine, there are 2 types of DM, type 1, type 2. In Ayurveda, we are talking about 20 types. Is there any special correlation of these conditions among both medicinal systems? This is open again to all of you, whoever would like to talk about it.
To explain it in brief, of all the types explained, 4 are Vata types, and it is explained that the Pitta types and the Kapha types, the other ones, if they are not treated well, it can turn into the Vata types. And in the Vata types, there are 4, and one among them is Madhumeha, which is largely correlated to diabetes mellitus, which we are discussing today. So that can be the answer in brief.
And the last question I'm going to actually ask, and this is open to everybody, is what are your thoughts on Gymnema sylvestre when it comes to helping stabilizing blood sugars? Can you also recommend a good probiotic that can help the gut microbiome in addition to a good diet and daily exercise and stress reduction? This is open to everybody.
Yes, sir.
Vivekji, please.
The leaves and extracts of containing gymnaic acids, the major bioactive constituents of the Gymnesta sylvestre, interact and taste receptors on the tongue to temporarily suppress the taste of the sweetness. That's why it works as an antidiabetic property, and in local language is known as maize stringy, which is very effective medicine in diabetes mellitus.
Thank you so much, Vaidya Vivek. Anybody else wants to add into that?
Yeah, it is a wonderful herb, and most of the modern proprietary Ayurveda formulations, which the Ayurveda pharmaceutical companies make of their own, almost all, I can blindly say, contain Gymnema sylvestre. And there is a study in which it was concluded that it may help significantly to stimulate insulin secretion and the regeneration of pancreas islet cells, both of which can together help in the maintenance of blood sugar and treat diabetes.
Thank you so much, Vaidya Hebbar. And Zarna, would you talk a little about when it comes to the good probiotic, a gut resistant, acid resistant that can help with the gut microbiome?
Sure. So as far as the good probiotic that can help improve the gut bacteria, any probiotic that's a combination of lactobacillus and a bifidobacteria to combine is one of the best probiotic. One thing to know, there are I don't even know how many thousand probiotics on the market right now. It's a lot. So the key factor to look for any probiotic is that make sure that you look at the studies that are done by a third party and not by the company who's making them, because then it's a very biased study in itself. So that's one thing that I highly recommend. There's also a lot of interest coming up in probiotics that are rich in Akkermansia manusiphilia. So looking up at one of those can be very, very beneficial. But no probiotic supplement can do anything if they are not fed. So if you put the probiotics in your body, but then leave them starving, they're going to die. So how do you feed them is going to be with all the prebiotic fibers so all the leafy vegetables, the garlic, the chicory root, the onions. These are the prebiotic fiber which are going to help feed those bacteria. So you put in some and then you feed them, you flourish your garden. And that's the way you can sustain that, because otherwise you can keep taking supplements after supplements. It's just a patch relief, and that's not what's going to really help you in a long term in general. So that's what I would recommend. Lactobacillus, bifido, Akkermansia. Any of that combination is probably what would be the best, in my opinion.
Thank you so much, Zana. That's wonderful, perspective when it comes to the gut microbiome. And because there's a lot of confusion, a lot of times, especially with our client and our patients, they have a lot of confusion with the probiotic as well. So we are towards the end of our session. I mean, I would love to, go on much more. I know we can go much more on this as well. We have so many questions we had, but in the view of time, we are going to actually stop over here. And again, I would like to thank all our esteemed panelists for being here and, spending your time, giving your perspective. It was such a wonderful discussion, talking about through Ayurveda, through modern nutrition, to modern medicine, through nutrition, what is a perspective? And it gave our viewers a lot more comprehensive view when it comes to diabetes. So we would like to conclude our session today. And I would like to request our Vice President of AAP, Vaidya Meenakshi Gupta, to have a vote of thanks, and also she's going to also talk about our membership again with all of us. Vaidya Meenakshi Gupta.
Thank you so much, Vaidya Gauri. I would like to say thank you so much to everybody who is participating in today's Sambhasha webinar series, especially to the esteemed panelist. Your insightful contribution always enrich these discussion, and we have spoken to many of you on different platform also, and your contribution always make the session truly beneficial for the community as well as for the seekers who love to learn more about the Ayurveda. With that, I also wanted to encourage each of our attendees to consider joining up. Together, we can further our mission, expand our reach, and continue advancing in the field of Ayurveda. Your membership will contribute to our efforts to promote education, as well as empower all Ayurvedic professionals globally to practice, teach, and research authentic Ayurveda to improve the community health and well-being. Thank you for your support. And as a Vice President of AAAP, I look forward to more community contributions, collaborations, and more insightful discussion on our Sambhasha panel, which is going to be on every month. Thank you so much.
Thank you so much for everyone. Thank you so much for all our viewers to join us and all our esteemed panelists, as well as different healthcare professionals and students, as well as Ayurveda enthusiasts who have joined us today. And keep tuned. Again, please be members. And we will be bringing these sessions for you, a lot of these educational sessions every month. And we'd love to have you as our members. Thank you so much, everybody.
Thank you.